Heart failure is now eminently treatable with very effective medications. Yet, following a few lifestyle changes and precautions will go a long way in improving your quality of life and slow disease progression. Maintaining or reducing weight is important in reducing the risk of worsening of heart failure. Another aspect is that weight gain can be an indicator of increasing fluid retention in the body. Excessive fluid retention occurs when there is worsening of heart failure. So, undue weight gain should alert you to contact your physician for adjusting dosage of medications. Monitor your weight daily at the same time, preferably in the morning before breakfast but after the morning routines. Undue weight loss can also be an indicator of worsening heart failure. Severe heart failure causes fluid to collect within the inner lining of the stomach and reduces your appetite and food intake. Certain hormones released into the blood in those with severe heart failure can also cause loss of muscle mass. As a part of maintaining an ideal body weight, it is good to keep a track of the amount of fluid which you take every day. Excessive fluid intake can cause fluid retention, especially if the salt intake is also high and cause worsening of heart failure. In those staying at home, monitoring the daily urine output and balancing it with fluid intake can be useful. Generally, the urine output will be about half a liter less than the fluid you take. This is because of loss of fluid in breath and sweat. But this can vary with climate and can be higher if you are sweating a lot. Urine output can be higher in the initial days of treatment when medications flush out the extra fluid that has been retained during a worsening of heart failure. If the urine output remains high, too much of sodium and potassium may be lost from the body. Your doctor might ask you to check the blood levels of electrolytes in such situations and advise correction if needed. Importance of quitting smoking in those who smoke cannot be overemphasized. Smoking temporarily increases heart rate and blood pressure as well as reduces the oxygen content of blood. Smoking increases the chance of clot formation in blood vessels and formation of blocks in the blood vessels supplying oxygenated blood to the heart. Alcohol is another intake which has to be curtailed. Alcohol can directly weaken the heart muscle and also cause a fast, irregular heart rhythm which is known as atrial fibrillation. Occurrence of atrial fibrillation will cause rapid deterioration of heart failure. Medical advice should be followed strictly in this case. Of course, it may be better to avoid alcohol altogether. Limiting or avoiding caffeinated drinks is also important in those with heart failure. Salt intake has to be restricted as advised by your physician. Sometimes higher intake of salt may be advised when your blood sodium level is low after taking medications to increase urine output. But this is usually for a short period till the blood sodium level is in the normal range. Elderly who have frequent episodes of low sodium may need to monitor electrolyte levels more often. Heart-healthy diet with fruits and vegetables, whole grain, fish and nuts are good for you. Sweets and sugar-sweetened beverages have to be limited. Food with high saturated fat and trans fat, usually fried food, have to be limited. Taking too much of bakery items may also be avoided as they usually have higher salt content. The importance of regular physical activity has also to be stressed. But a tailored exercise program suiting your physical condition has to be chalked out in close consultation with your doctor. A monitored cardiac rehabilitation program can be considered when available in your community. Always start low and build up gradually. Never overdo it, as too much of exercise may land you up in the hospital emergency department. Other important aspects are regular monitoring of blood pressure, taking adequate rest, and getting good sleep. A big meal before bedtime is better avoided. Short nap after lunch may be comfortable. Those with shortness of breath on lying down flat may benefit by propping up with more than one pillow. Vaccinations for common diseases which can cause worsening of heart failure, like flu and pneumonia, are also worthwhile in consultation with your doctor. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.